Let's go over the next type of impulse control disorder, kleptomania. A 25-year-old woman has a history of more than 20 arrests for stealing small items. She comes from a wealthy family and her parents do not understand her behavior. At home, she has numerous salt and pepper shakers, napkin rings, ashtrays, etc. So what we have here is an individual who basically has the recurrent failure to resist impulses to steal objects that the patient does not need. That is of the essence. This is not a woman stealing food because she and her family are hungry. This is a woman stealing things that she does not need. And that is the hallmark of patients who have kleptomania. It's much more common in women, and it's usually due to some stress in your life. So the higher the stress level, the more likely that the woman, as a sense of relief, will engage in some kleptomaniac activity. Now, of course, many of these women can have certain mood disorders. You can have OCD, eating disorders, brain diseases, or even mental retardation. As far as other symptoms, you can have anxiety, you can have depression, and some of them do feel guilty or ashamed of their actions, but they do sleep at night even though they feel guilt. The treatment will always be insight-oriented psychotherapy. You might try behavioral therapy, systematic desensitization, or pharmacotherapy with the use of SSRIs. But again, since there is no specific treatment for kleptomania, I doubt very much that this is a treatment-driven question, and I'm sure it's more of a diagnostic-driven question. The differential diagnoses will always be the antisocial, malingering, mania, and the schizophrenics. Remember, antisocials are not going to steal napkin rings. If they're going to steal anything, they're going to steal things that are worthwhile. Malingerers might pretend to be sick, but they'll probably steal things that are worthwhile as well. When you're manic, you're going to be stealing things when you're manic, but you'll see a cyclical component or an intermittent component to the stealing. So that will have to be part of the question for you to determine whether it's mania and that's when you're stealing, or are you stealing all of the time. And can you be schizophrenic and steal? Sure. But kleptomaniacs typically do not have any psychotic symptoms.